Parents want to protect their children's health, and making the right choices can feel overwhelming, especially when it comes to something as important as vaccines. But today's COVID-19 vaccine guidance is more confusing than ever, with new headlines and changing recommendations appearing almost every week. Two top health organizations, the American Academy of Pediatrics, AAP, and the CDC, now offer different recommendations for kids, adding to the uncertainty many parents feel. The AAP strongly urges vaccination for young children, emphasizing the benefits of protection against severe illness and long-term complications. Meanwhile, the CDC has scaled back its advice for healthy kids, suggesting that the risk for some children may be lower than previously thought. This split leaves families unsure about what's best, and many parents are left searching for answers they can trust. We'll break down what each group recommends and why, giving you a clearer picture of the debate and the science behind it. Our goal isn't to tell you what to do, but to give you the facts you need to have an informed conversation with your child's doctor and make the best decision for your family. When experts disagree, it's easy to feel overwhelmed, anxious, or even frustrated by the lack of clear answers. But with clear, balanced information, you can focus on what matters most, your child's health and well-being both now and in the future. Let's explore what these changes mean for your family and how you can move forward with confidence, knowing you're making the best choice for your child. The American Academy of Pediatrics, or AAP, is a leading organization representing thousands of pediatricians across the country, all dedicated to the health and well-being of children. The AAP strongly recommends that children between 6 and 23 months old receive the COVID-19 vaccine, emphasizing the importance of early protection for this vulnerable age group. Their recommendation is grounded in research showing that even very young children can face significant risks from COVID-19, including hospitalization rates that are surprisingly similar to those seen in some older adults. For older children, the AAP suggests a more individualized approach, taking into account each child's unique health needs, especially for those with chronic conditions or who live with family members at higher risk. The AAP's confidence in the vaccine comes from multiple studies that demonstrate both its safety and effectiveness in protecting young children from severe outcomes. They believe that, for most children, the benefits of vaccination far outweigh any potential risks, particularly when it comes to preventing serious illness and long-term complications. This strong stance from the AAP puts them at odds with the CDC, marking a rare and notable split in public health guidance that has sparked discussion among parents and professionals alike. The AAP maintains that its advice is firmly rooted in the latest scientific evidence and guided by a deep sense of responsibility to protect children's health. By taking this independent stance, the AAP demonstrates its commitment to what it believes is the best available evidence, always prioritizing the safety and well-being of children and their families. The CDC, under new leadership, has dramatically changed its approach to COVID-19 vaccines for children, marking a significant departure from previous guidance. As of May 2025, the CDC now recommends the COVID-19 vaccine only for children who are moderately or severely immunocompromised, rather than for all children as before. This means that healthy children are no longer routinely advised to get vaccinated, a move that has surprised many parents and healthcare providers. Importantly, this shift isn't because of any new safety concerns or alarming data about the vaccine itself. Instead, it reflects a change in leadership and a new philosophy about public health priorities and risk assessment. The new Health Secretary, Robert F. Kennedy Jr., has replaced the CDC's long-standing Vaccine Advisory Committee with his own appointees. Many of these new members are known for their skepticism about vaccines, which has influenced the agency's recommendations. The American Academy of Pediatrics and other major medical groups have strongly criticized this move, warning that it undermines public trust in vaccines and could put vulnerable children at risk. The CDC's new stance has fractured the usual partnership between public health officials and pediatricians, creating uncertainty and confusion for families who rely on clear guidance. Now, parents and doctors must navigate two sets of advice, one from the CDC and another from leading medical organizations, all while trying to make the best decisions for their children in an increasingly politicized environment. The result is that families are left to sort out conflicting guidance on their own, often feeling overwhelmed and uncertain about what's truly best for their kids. The split between the AAP and CDC affects where and how your child can get the vaccine. Pediatricians following AAP guidance will likely discuss and offer the vaccine for young children. Pharmacies, bound by CDC recommendations, won't actively promote the shot for healthy kids, but may provide it if asked. This means less proactive guidance at pharmacies and more reliance on your child's doctor for advice. Insurance coverage is also uncertain. Without CDC endorsement, some plans may not cover the vaccine for healthy children. The AAP is pushing for continued coverage, but parents may face out-of-pocket costs. It's important to check with your insurance before scheduling a vaccination. These practical hurdles add to the challenge of making the right choice for your child. Your pediatrician is your best resource for navigating this confusing landscape. Ask them to explain both the AAP and CDC recommendations, and which they follow. Discuss your child's health history and any specific risks they may face from COVID-19. Ask about the benefits and risks of the vaccine for your child's age and health. Consider your household's unique situation. Are there vulnerable family members to protect? Don't forget practical questions. Will insurance cover the vaccine? What's the recommended schedule? By asking targeted questions, you can move past headlines and make an informed decision. Partnering with your doctor helps ensure the best outcome for your child's health.